Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Unfortunately, we're on the way to the studio, not into the studio. Why? Because we were sitting in the middle of a Legion Bridge, and there was a very horrible accident that had things tied up for probably the better part of the last 45 minutes. So, the best laid plans, as they say. But you know what? It lays out specifically the topic that we have for you today. You've had problems, and the one that we're talking about really affects something in the neighborhood of over 80% of the population at one point or the other. So what are we talking about? We're talking about headaches. And headaches are one of those things that cost more money, more downtime to both the patient and the employer than any other condition that you can begin to describe. Why? Because guess what? You don't get to go to work, and when you don't get to work, if it's not planned, then you don't get paid, and if you don't get paid, you don't have money to spend, and if you don't have money to spend, then there are other people who can't meet their bills and expectations. So it's a very interesting spin-off, but more importantly, understanding of headaches is critical because a headache is not an aspirin deficiency. And with me today, on the way to the studio, we'll be there hopefully in a very short period of time, somebody who really understands the process completely, Dr. Matt Adams. So, Dr. Matt, guess what? We have a problem.
Yes, we have a little problem in the car, but we're making it happen. We're making it work. So, but we're being there shortly. But it is nice to be doing the show with you in the car. Nice weather outside, the sunshine. Can't complain too much.
No, so we only have a stress-induced headache, and actually we're going to talk about several types of headaches. And this Wednesday evening, you will be our presenter at the Roselle Center for Healing at the Fairfax office, and you're going to be talking about headaches for our in-house continuing education program. So if you've been suffering from headaches, you're on a ton of medication, you have anything from a migraine to a cluster headache to what they call muscle contraction headaches. By the way, that's the most common. Approximately 70% of all headaches are muscle contraction type of headaches. And we have a term for that we'll get into as the show goes on today. But muscle contraction headaches are the most common. Migraines of many different kinds, we'll call common migraines as well. They're the ones that people say, well, I have a migraine. Well, you may have a migraine, you may not have a migraine. They're very, very typical. And what I'd like to get into, Dr. Mack, is in initial phases here is the distinguishing features, if you will, of different types of headaches that we'll talk a little bit more about.
Okay, so we've got, migraine headaches typically is a vascular blood flow issue that we'll discuss. And there's many reasons that can cause a decrease in blood flow or even an increase in blood flow to the brain, and that can cause pain in there. And then, like you talked about, you've got the muscular contraction headaches. A lot of times we associate these as stress headaches. Whenever your shoulders and your neck get real tight and tense and it gets sore back there behind your neck, and then you get this headache kicking in. And so we're going to talk about that. Also, we have what we call cervicogenic headaches, and we have headaches from misalignments of the spine with all the nerves going around the head. So there's a lot we're going to talk about, what we're going to get into, and even more we're going to get into on Wednesday.
This Wednesday night is kind of a revealing night, if you will. If you've had any kind of significant problems with headache over the years, you've quieted them down, so to speak, with different medications. The patient will come in and say, well, it's not bad as long as I take this type of medication. Well, there are other types of medications as well that will give you a headache. And, Dr. Matt, the number one cause of all dull headaches, it's called dehydration.
Yeah, exactly. We're an extremely dehydrated group of people now. Not just, a big part because we're just not drinking enough water, but also the things we put into our body that flush that water out or build up the toxins in our body. And so we even need more water than, we really should need if we weren't doing those things. So the dehydration, you think about your blood has lots of fluid, lots of water in there. And if you're not getting the fluid and water, you're going to get a slower flow to the brain, and eventually your brain's going to go, hey, I need some more blood here. Let's do something about this. And so it's either going to open things up and flush it in there, and that's going to cause problems because there's only so much room that you've got, or your brain's going to have a reaction with the blood vessels just trying to get it there or just not feeling good for being there. So, yeah, dehydration causes big problems.
People should just stop and think for a minute how they feel on a really hot Virginia day or metropolitan Washington day where it's nasty outside, it's high 90s, and the humidity is about the same, and you have that lethargic, run-down, dull headache type of thing. That's dehydration. And it's very easily fixed. Go get a glass of water, put a little salt in it, and you got a quick fix on the situation. But we don't think about that. And the other reason that dehydration is such a problem is because of the high toxic levels in our body. We don't eat well. We don't drink well. We're exposed to all kinds of pollutions. And these things build up in our body, and the dullness of all this toxic waste in our body is what's really causing our heads to scream, if you will. And if we just take the time and we drank water, put a little bit of lemon in it, a lot of these things go away. But we're going to get into the next phase. The second half of the program, I want to talk a little bit more about the structural pieces, and I want to talk about the medications that cause headaches. But let's talk a little bit about this vascular type of headache. And by definition, a migraine is nothing more than a vascular compromise of some sort. And you and I have been talking about it, kind of wasting the time on the way, not wasting the time, but, sitting here in the middle of traffic. And unfortunately, whoever was in that accident, I hope they're well because it was pretty ugly. But nevertheless, vascular headaches are a compromise in the blood supply of the brain, and it can be inflammatory, it can be restrictive, it can be many different things. Let's talk a little bit about the inflammatory process that you and I were talking about and debating a little while ago.
Well, yeah, we were talking about inflammation. When we think of inflammation, most of us think of, I've got a swollen ankle, I have my elbow hurts, it's swollen. So the same things can happen inside the blood vessels in our brain, which is not an area you really want to have inflammation. And so inflammation doesn't always have to come from an impact like a bruise, like we think of. Inflammation comes from your body's your toxins in your body. And so if we have inflammation, it's going to cause swelling in those blood vessels. And that swelling in the blood vessels causes irritation to the area of the, where they're going in the brain, to the blood vessels. They're causing that diffuse pain. And so you have to ask yourself, well, what's causing that inflammation? Why is it inflamed? Well, any time we have a response from a toxin, or think about poison ivy. That's a toxin that touches your skin, you get inflamed. Well, a similar thing with histamines, inflammation is happening inside your head. And it's not a pretty picture, but that's what's happening. Is you're getting that inside your head, you're getting compression and swelling of those vessels, causing all kinds of pain all over the place. And so we have to calm that down.
In other words, what you're talking about are fat heads, right?
It's fat heads. I don't know about fat heads. I think we're all fat heads because most of the brain and tissue around there. I heard that from Bill Nye, the science guy, once when I was younger. If you can call somebody a fat head, it's okay because it's true.
Well, the thing is that swelling that comes about from allergy reactions and foods, and the headache. Here's the dehydration headache that people don't think about. When you go out and you've had way too much to drink the night before, that that pain that you get is from the alcohol dehydrating the cerebral spinal fluid, which buffers and cushions the brain. And one of the easiest remedies is, one, to burn up the alcohol. You do that with vitamin B complex and vitamin C, but also sit there and really start slugging the water down and get your tissues rehydrated, and it begins to go away. But it's really picking the pieces apart, what causes them. People don't have to suffer from headaches, Dr. Matt. They don't have to put up with the nonsense. It's a matter of really getting to the underlying why is that. This Wednesday evening, Dr. Matt Adams will be your host, your presenter at the Roselle Center for Healing. What is he going to talk about? Headaches, all kinds of headaches, migraine headaches, cervical contraction headaches, dehydration headaches, allergy headaches, you name it. That's what he's going to talk about. If you'd like to join us, and we encourage you to do so, all you have to do is call our office at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend Dr. Matt's presentation on headaches. And as always, what we'd like you to know and remember as these presentations are a gift to our community. We try to do these for your benefit. There's absolutely no charge, but we do require a reservation. So if you would be so kind as to pick up the phone and call 703-698-7117. We'd like to dedicate everything that we do to you as we are right now. See, we don't drop these programs. We make shift, even though that this situation is giving us a little bit of a headache, and we're sitting here trying to figure out how we're going to get to the program. But we're almost there.
We're almost there, and hopefully we don't get cut off underneath the when we go in the parking. So we're also going to talk about, we didn't mention the structural part of the headaches, which I think is the predominant reason most people have headaches. They think they have migraines, but really the artery, the vertebral artery that's running up to the brain actually passes through your upper neck, through the vertebra there. So a lot of times people have misalignments in that vertebra. It's actually putting some pressure on the blood flow to the brain, and they don't realize it. And it's causing, it can also cause the migraine symptoms, because once you relax, possibly you take a little pressure out there, now you get another increase in blood flow, which once again we talked about swelling and everything that's causing, that can cause the pain there. Let's also talk about, we talked about subluxation on this show before. What about the nerves that are passing through there?
Matt, and I don't know if you know the story. We talked to Dr. Pina, interviewed me last week on the air, and the reason that I ultimately became a chiropractor and went into acupuncture nutrition is because of the headaches that my wife suffered for so many years. Sue had migraine headaches from the time she was 6 years old, and they got progressively worse to the point where they were devastating, and she had to resort to medication that was so awful that either the medication or the headache would totally take it away from her. So, it's under the hands of a chiropractor out of Elgin, Illinois. Sue's headaches resolve themselves, and that's why I do what I do. But what we learned from that, and the type of headache that she had, and the type of migraines that she had, was a blood supply headache that you were just talking about. The nerves were restricted. The blood supply was restricted. The muscles were contracted at the back of her neck. She was an intense young woman, a very, very intense student, a very good student, and she would relax in the evenings, or she would relax at the end of the week, and all that blood that was being restricted to the back of her head now opened up like a floodgate, and it caused that situation, that pain, that pressure, that compression, the vomiting that she had, the inability to look at light, all those things that people normally get, simply because her neck, her vertebrae in her neck, the bones in her neck were misaligned in a way that was causing that restriction, as time goes on. And I know we're going to talk about that a little bit more. It's really important that people understand that there is a why, that it didn't happen to them, that there's things that go on. The intestinal system is one of the primary culprits of different types of headaches, simply because of the fact that they alter the different type of brain chemistries, things from serotonin and dopamine and GABA, they're produced in the gut. Matter of fact, 80% of all brain chemistries are produced in the intestinal tract. So when that happens, things don't step up the way they should, and we end up with pain. And we're going to talk about that very, very in-depth as we go through into the next part of the program. And hopefully we might even be in the studio by the time that comes about. But we're coming up to a break, and we have to pay attention to some very important listeners and people who pay for Dr. Tom Roselle Live. So don't go away. We'll be right back.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio. We made it up the stairs. We're here at 888-630-9625. That's 888-630-9625. Love to talk to you. We're talking about headaches, and if you have one, and I think I'm getting rid of mine. The intention coming across that Legion Bridge was something else. My jaws were clenching, back of my neck was tight, my head was throbbing. And fortunately, we were able to link in. See, we are dedicated to you and make sure that you get this program. Give us a call, 888-630-9625. Dr. Matt Adams in studio with me. We're both here. We made it up the stairs. The guy actually let us in without my pass. I had to beg him, and cried a little bit, but nevertheless, he said, go ahead. But we're here. We're talking about headaches, and that's what you're going to talk about this Wednesday evening, the 2nd of October. Oh, my God, it's October already.
I know, crazy.
And 7:30 p.m. And if you'd like to attend, all you need to do is call our office at 703-698-7117. That's 703-698-7117. Tell my staff you'd like to attend Dr. Matt's presentation. We're talking a little bit about all kinds of headaches. We started getting to migraines, and we talked about the blood flow type of headache that comes about basically like if people understand the back pressure in a dam, all that pressure building up more and more and more, because what happened is that the safety valve gets narrowed down. It's not taking that back pressure out of there. So you have this push of water. Same thing with blood. You're getting this push of blood. And now what happens is somebody opens the valve. But the force is so great that all the tissue in the brain, the blood vessels and so forth, are being engorged with this extra amount of blood that the body was not able to handle, and now you got pain.
It's like whenever it's like pain with your sibling when you're younger, and they've got the water hose, and you hold it down, so then they look at it to see where the water's coming, and then you let go.
That's right. That's exactly, and they get a face full.
Yeah.
See, you were a rotten kid too. See, just
I was
like
just a big brother. I wasn't a rotten kid, just a big brother.
You were a lousy, rotten kid, just like every other male boy that would. Never mind. Well, anyway, we're talking about headaches, and that's really what happens: is that blood flow gets in there, and it causes. But with migraines, Dr. Matt, there's a tendency for migraines, and people say, "Oh, I got a migraine headache." But migraines are typically one-sided. They're vascular in presentation. But they're not always what people think are a migraine. It's not. It can be something that's a little different. What's that distinguishing feature?
Well, you have a couple of distinguishing features. You can have it on both sides, and people will think it's a migraine. And a lot of times in the office, we'll find that it's the actual nerves that are passing from the neck or from the back of the head that go across to the front. And I think a lot of times people just think of a serious headache and just call it a migraine, when really it's not. We have different classifications for them, but most often headaches, even when people think of migraines, it's coming from the neck, it's coming from the upper neck. It's coming from the muscles pinching down on the nerves of the neck. It's coming from the the top three vertebrae. They share the nucleus with what we call the trigeminal nerve, which is the nerve that gives sensation around the scalp and the face and the body. They share that nucleus with the top three vertebrae. So you'll have maybe you had a car accident a long time ago. Maybe you slept wrong, and so those joints shift over just a little bit, start putting pressure on there, and now you get this severe pain coming up one side, maybe both sides of your head, and you think, oh, it's a migraine, but it's not. It's really coming from your neck.
It is, and there's so many distinguishing features with it, and we can have that blood supply problem from one side of the neck or the other. It doesn't have to be both. We talked about the vertebral arteries causing that. We also have a energetic presentation with Dr. Pien, and I will talk about that on a regular basis, because the acupuncture channel for the gallbladder starts at the eye, and it comes over the top of the head, and it goes down and ends in the foot. So energetically, when there's referred patterns, and this is a typical referred pattern, it goes in the eye. It feels like somebody's got a knife sticking it in your eye through the back of your head, and the pain becomes almost insurmountable. And people go to bed, they have to close the drapes, they have to take medication that would knock a horse down. So these things, can really lay people out. As we said in the beginning of the program, this is a condition that really knocks so many people out. When we get in the second half, I want to talk a little bit about the hat band headache. I want to talk about some other distinguishing features of some of the medications that people are taking that are causing headaches to occur. And I know you're going to cover them at length. If you'd like to join Dr. Matt this Wednesday evening, October the 2nd, please do so. And all you have to do is give us a call at 703-698-7117. Make your reservation for that class. We'd love to have you as our guest, as always. And we're there. All of my doctors are there to answer your questions anytime, whether it's on the program or whether it's at one of our classes. And you can either go to rosellecare.com or give us a call, and we'll get back to you. We've got to take a break. There's a call that I'm going to take when we get back, so don't get off there. It's very typical of a very specific type of headache. We'll be right back. This is Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are indeed in studio. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem. You've tried. You've applied. You've come up with the same old, something that really doesn't do anything for you. Well, here's your opportunity. Let me show you how to do it without drugs, without surgery. We're talking about headaches, and Dr. Matt Adams, my guest in the studio today, who's going to be your host, your presenter on headaches this Wednesday evening, and I had a headache coming up from Virginia to Maryland, Washington, to the studio.
That happens a lot out here, I've learned, in this area.
It does. You have to learn how to adapt. But we were very adaptive.
We were
proactive. We figured it out, and we got into the studio, and they hooked us up, and Jeff knew exactly what to do, and we were cool, and, so we were able to do the program. Now I can relax. Dr. Mladenoff, my dear friend from Kansas City, rings in my ear. I told you a little bit on the elevator on the way up. You asked if anything like this has happened before, and I said only one time, when Dr. Mladenoff and I were at an ICAK, an Applied Kinesiology conference in Los Angeles, and our portable broadcast unit, the Comrex that we take with us, didn't work. And it worked and it didn't work and it broke up, and then we had to go to cell phones. And so what we were talking about appropriately was stress. That's why he was on, because Dr. Mladenoff wrote a book, stressed out headed for burnout. And it's a tremendously insightful book of what happens. So he's sitting there very calmly. We're in a hotel room. We're laying on the beds talking. Sue's sitting there laughing at us. I'm freaking out because, I want the show to be quality. And so he sits there and he says, Dr. Tom, he said, did you tell your audience what the last state of stress is, last stage? And I looked at him and I said, you really going to do this, Dr. Mladenoff? And he says, well, they have to know. When you finally go into the relaxation phase, you're going to have to go urinate. And I looked at him. I said, Evan, I can't believe you. He said, well, it's in my book. Anyway, we're talking about headaches, not... Yes, we are. We're talking about adrenal stress as well. But nevertheless, let's go to the phones. Fred, thank you for being very patient and putting up with us today. How can I help you, sir?
Good morning, doctor. First, I drink a lot of water and no soda, so my problem I don't think is water related. But in the first week of February, I came down with debilitating headache, vertigo, and tingling down in my feet. I don't know if they're related, but the headaches were so bad that I literally had to lay down and just spend most of the day in bed. It got so bad that about the middle of March, I went to the ER, and they did an MRI and blood tests and X-rays and urine tests, and everything was normal. So they sent me home. What I didn't realize at the time was I had been taking oxycodone for my knee. I had one knee replaced, and I was getting ready to have the other knee replaced.
That was one of my questions I was going to ask you. Go ahead.
So when I looked up the side effects of oxycodone on the internet, and I just stopped taking it. Now that kind of limits my mobility, but I don't take any medication, just vitamins and supplements. And
have you ever had high blood pressure, Fred?
No,
okay.
I have white coat hypertension when I go to the doctors, but I have my own blood pressure gauge that I check my blood pressure here at home, and it's always well under 120.
Okay, what I want you to do is this here, because you're showing me a typical pattern. And first, I'm going to ask you a couple quick questions. In the last couple years, have you had any trauma, injuries to your body, car accident, falls, anything like that?
No, sir.
Okay. Have you had any dental work done?
No, not I haven't had any dental work done in a long time, 10 years. But I have had, just recently, within the last 6-8 months, I've had a couple of teeth break off, where they were filled, and they were heavily filled.
Okay, so it's the same correlation. So here's what happens. There's two things that stick out real quick when you're talking about this type of problem. When your teeth don't hit properly, you lose what's called the vertical dimension of the mouth. It means that they just don't hit, and it shoves the temporomandibular joint, your jaw joint, in a bad place. The jaw joint is called the pump handle of the rest of the skull. So if it's misaligned, it's not setting the way it's supposed to, it's going to cause the plates. There's 22 bones in the skull that make up your head. And if they are not moving as you breathe in and out properly, then that's going to cause you a headache. And particularly when you lay down, it can increase the problem because the movement of spinal fluid isn't doing what it's supposed to be doing. So see, when you're up and moving around, your body is mechanically adapting to try to move spinal fluid. When you lay down, it's not moving anymore.
Well, doctor, when I lay down, I get relief.
Oh, is that okay? Then it's
and the headache is mostly right. It feels like it's right behind the forehead.
Okay, so then there's a couple of things that we're talking about. I'm looking at the call screen, and I can't see the entire thing. I was interpreting it says that when I laid down, it got worse, but it's not. So
no,
it gets better.
I get relief. I've been laying in bed since 8 o'clock this morning.
Okay, so that puts a different twist on the subject. So here's the deal. If it gets better when you're laying down, then it's got to be a contraction type of headache where you're laying down, the muscles begin to relax, and they allow the nerves to release and let go so you're not getting the compression. But there's two very distinguishing situations here. One is the oxycodone that you were on, and two is the teeth that you broke off, not allowing for normal dimensional leveling, if you will,
and I
of the jaw.
I can feel it in my mouth. I can feel my mouth feels awkward when I close my teeth.
Even though that we could evaluate that, but we would end up referring you out, the first thing that I would do is go see your dentist or go see somebody more specifically that understands neuromuscular dentistry, that knows how that vertical dimension should sit. If you do that, I think that your problem will be eliminated. The Oxycontin, the fact that you're having to take that, there's other things going on in your body. There's inflammatory pathways that aren't working the way they're supposed to, Fred, and that can be helped. That we can help you with, but the first thing you need to do before you do anything else, go see a dentist. Obviously, Dr. Michael Chung is somebody that we support and think that he is excellent when it comes to mechanical work, but you need to do that, and you need to do that soon. Then call me and let me know what the outcome is, and I'll be more than happy to interpret anything that they say to you. So you can call me either or that to get a hold of me on email. But let's do that, Fred, and do that first, and I think that you're going to eliminate your problem. Cindy, how can we help you? Cindy? Cindy, are you there?
No.
Hello?
No, I think I still hear Fred.
All right, so we'll get back to Cindy as soon as we can get her back on. Cindy, are you there?
Yes, sir. Hello?
Hi, thank you. I was trying to get you online, and it's just one day of one thing happening to another. Cindy, how can I help you? Tell me about your migraines.
Yes, sir. I was on a Bluetooth. Perhaps that was the problem. I'm calling because I have been suffering with these headaches for roughly 12 years. I also have a family member that has suffered with them since she was a child. But my headaches started probably in my mid-30s, I guess, and I would get those cluster headaches, or I guess you would call it, in the eye, one side, and, like you described how the knife and the searing pain through the eye, right. They were absolutely debilitating. And then I was also getting menstrual migraines. I was getting them prior to my menstrual cycle, and that was very debilitating, and then I would get them after. So it seemed like the estrogen dumping was causing some kind of severe headaches as well.
Estrogen and progesterone, by the way, but go ahead.
Yes, sir. So for a while there, I had things under control, and the headaches seemed to subside, and now they're back. And this time, the headaches are coming at the base of my skull. Sometimes I wake up with them. I can be, or just going through my normal day, and then all of a sudden, as of yesterday, I've got this severe band of pain at the base of my skull. And with my headaches, I cannot lay down. I have to sit up in a chair.
Cindy, the headache that you're describing, both headaches, the menstrual cycle headache and the other migraine that you're describing in your eye, are probably related to the same situation. Your liver and gallbladder in Chinese medicine are yin and yang, if you've heard those terms, positive and negative. They balance each other. And so the gallbladder is a receptacle. That's all it is. It for the end product of whatever happens in liver. It's the liver produces bile. It stores it in the gallbladder. Then when you get a whole bunch of fat in the intestinal tract, the gallbladder with the pancreas squeeze, and it breaks it up. It breaks up the fat. So what's taking place on the first blush tells me that your liver is not processing the way it's supposed to, because the liver is responsible for processing all hormones. So if the liver is toxic, it's by the way, it's called phase 1 detoxification within the liver. It's cytochrome P450 for just so you heard it. I don't expect you to know anything about it. It's the way the liver handles the buildup of any type of hormone. And if it can't do it, then there's a backup inflammatory reaction that occurs. Now, why the eye? Why the head? We talked about earlier the outside canthus, the outside portion of your eye, is the beginning point for gallbladder 1 on the acupuncture system. And it goes up over the top of your head, and one of the second major points is right at the base of your head. Now, the channels are bilateral. They're on both sides. And so if that system is toxic in acupuncture, you would say excessive, then those areas are going to be very hot, so to speak, and they're going to cause you pain. And when they're going to cause you pain would be at the time that the liver has to work far harder. So you would see it during your menstrual cycle. You would see it mid-cycle, because that's when it's going to start building up, and then both the estrogens and progesterones get to a peak, and then they're supposed to drop off. But if they can't drop off, and they're still hanging out in your blood because the liver can't do its job, what you're getting is an inflammatory reaction headache that's associated with the area that's attributed to that acupuncture channel. So you have to look at those. And not an accusation. I'm just going to give you my mantra of sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives. If your diet is loaded with those things, or you've been on different types of medications or antibiotics over the years where it's going to cause the liver and the intestinal tract not to work the way it's supposed to, then you're going to have a greater propensity to that. Now, the body has nerves, it has energetic channels, it has blood supply, it has toxic removal system called the lymph system. If those reflexes aren't working, then you're still going to get a backup. You're going to get this stagnant movement. It's like a river that's full of garbage and it's just sitting there and it smells and it's putrid and it's ready to burn. That's what happens to your head. So, and by the way, it's fixable and it's very definitely remediable.
I had my thyroid removed in 2011, as well as I had to have a hysterectomy at the same time in 2011. So, like I said, for a while there, it seemed like the headaches were.
Yeah. Why did they remove your thyroid?
Stage 1 cancer.
Okay, so that goes back to inflammatory reaction. I'm surprised that they took the whole thyroid, because if it's an isolated problem, they only take part of it. So now you're on artificial hormone. You're on Synthroid?
Yes.
Okay, so Synthroid is T4. T4, guess what, has to be processed in the liver to convert into T3. T3 is your active hormone. Okay. And so that's going to be another piece. So that underlying why is that would cause that to begin with is still there. They just dealt with the symptomatic presentation. I think that at least a consultation and no obligation to you. Come in Wednesday night, talk to us, and, I can give you more specific one-on-one and tell you really what's going on with this thing. You've got a problem that I think is very, very remediable, Cindy, and I just need to know a whole lot more, and we don't have the opportunity, unfortunately, because I could spend the whole program with you and just talk about those things. But, our gift to you, come in, talk to us, and like I said, no obligation. Appreciate it. We're coming up to a break in the program. This is the type of question I'd love to stay online with her, because it affects so many different people. There's an inflammatory process here, there's a neurological problem, there's an acupuncture problem, and if we began to pick them apart, I think that it would shed light on a lot of things for a lot of people. We'll be right back after these important messages.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle web store. That's drtomroselle.com and click on Roselle web store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
WMAL-FM Woodbridge, Washington. WMAL Washington, WRQX HD2, Washington.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're talking about headaches today. Yeah, we had one on the way to the show. We were stuck in traffic on the Legion Bridge, and that doesn't happen to me. I always do plenty of time. If anything, I'm always early. So that, Dr. Matt, that was like not a good thing for either one of us.
No, maybe it's just because I was with you today. I don't know.
Well, we won't get into that. It's bad enough that I harass you when we're in the office, but I won't do it here. You're too good of a doctor. You're too smart. You're too bright, and I don't want to disparage you in any way. As a matter of fact, you don't look like Skywalker today. You got a haircut.
I got a haircut.
You actually look professional.
Well, thank you.
You look good. I mean, you're all dressed up, jacket, shirt, and tie. You look excellent.
Well, thank you. I appreciate it.
Yeah. I mean, not next to me. I'm sitting here in scrubs and a goofy shirt, and, you know.
I got to balance things out.
You do.
I got to balance us, so that's why I dressed up today.
It's called yin and yang.
That's right.
Yeah, positive and negative. We won't talk about who's positive and who's negative yet. We'll discuss that on the way out of here. We're here every Sunday, and we're trying to bring people the most intimate and informed information on integrative care, things that they can do for themselves. This Wednesday evening, you're going to be talking about migraines, you're going to be talking about cluster headaches, you're going to be talking about muscle contraction headaches, and things that they can do for themselves and things that we can do for them. I haven't seen a headache other than one that's caused by medication that won't go away. And the medication headaches will go away if you pull it out.
Yeah.
Or there's a tumor, and then unfortunately either the tumor is resolved or the patient is no longer. So having said that, what I'd like you to do is take us step by step through what you're going to be doing. Topics. You don't have to give the whole thing away.
Yeah.
Okay? Talk to me.
So basically we're going to discuss, we've mentioned all these different types of headaches on here, and we're going to go more in depth and describe them. We're going to talk about the contributing factors. We're going to talk about what we keep talking about toxins and things. We're going to explain what that means. Like, what does that mean? I got toxins in me. You talk about, having a putrid head earlier. What does that mean, really? What are we talking about? Inflammation. And talking about what we can do about it. Why the things that we eat. Why the chemicals around us, how they actually affect us. Because I think a lot of people hear this stuff and they read things online about, I need to stay away from this or that. But do I really need to? Does that really affect my headache? And I think your explanation earlier, it says it does. How the liver, who thinks the liver is going to affect your head? A lot of people don't think that, the connection there. But the body's connected. We're going to talk about those connections and why, like our last caller, who has had these headaches for 12 years that no one can figure out because they're all looking at one area or another area. They're not putting it all and piecing it together. We're going to talk about the chemical, structural, emotional components and how the body is connected together and how all these stressors from all different areas affect different parts of the body, eventually causing pain in your head.
Well, the problem is that most traditional looks at headaches or any other type of condition is symptomatic relief, not solving the underlying why is that. And that's what we fight with all the time. Patient comes in, I want to know a whole bunch of information, as you do. You want to take it apart piece by piece and find out when they started, what were the initiating triggers, and so forth. We talked a little bit about different headaches, different medications that cause headaches. In women, one of the most common things are birth control devices. Anything that puts any type of hormone or alters hormone in the body is going to potentially cause a headache. It also increases the risk of stroke, which is not a good thing.
Well, the hormones affect everything from adrenal system to blood sugar system to your cholesterol. So that, of course, it would. And any of those medications, I guarantee you, about 90% of the medications, one of the side effects on there, it says.
Yeah, and antidepressants,
exactly.
are huge. And guys, by the way, all the Cialises and the Viagras and so forth, all the erectile dysfunction drugs, guess what? Number one side effect, headaches. Lousy blue headache.
They work with blood flow, and blood flow, the brain needs the blood flow.
Yeah. Well, that's a different story too.
Okay,
guys.
let's not go
there.
there.
Yeah, we're not going to go there.
Thank you.
Yes, I know. But, that's medical, Dr. Matt. We could really talk about, never mind. So we have to get off the air. You're saved by the underlying bell.
Thank
this
you.
Wednesday evening, Dr. Matt Adams will be your host, your presenter.
at the Roselle Center for Healing. He's going to be talking about migraines. Please be our guest. You're welcome to attend. Absolutely no cost to you. 703-698-7117, 703-698-7117. Tell my staff that you'd like to attend. Be our guest. We just require a reservation. We'll see you then, and we'll see you next week. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give